The eyes are on the Jersey Shore. I am Vin Ebenau at Cure RX Pharmacy here on Mule Road in Toms River with pharmacist Sharif Elmenchawy to talk about the COVID vaccine, where we're at, even though trends are going in a positive direction, the importance of still getting the vaccine, and how to treat any side effects that may come along with it. Sharif, thanks for taking out some time. I know even though, again, things are heading in a positive direction, it's still important to get the vaccine. So since you've been administering the vaccine here at the pharmacy, have you noticed a lot of people coming in to get the vaccine, or a lot of people asking questions or running things by you before they get it in terms of having any underlying conditions, any health issues?
Yeah, absolutely. First of all, thanks so much for taking out the time yourself and visiting here today, visiting us. Yeah, we've had a great response for the community on getting the vaccinations. Obviously, because they're new vaccines, there have been a lot of people who've had a lot of questions. They've been worried about possible side effects, adverse reactions, interactions with current disease states or medications. So I definitely urge anybody to obviously check with your doctor. You can check with your pharmacist, make sure that this vaccine is safe. As it is, and they've typically been extremely safe, and we recommend that anybody who can and should get the vaccine to help us all fight this battle and move on with the next chapter of our lives.
Now, I guess depending whether or not somebody has an underlying health condition or another illness or so on and so forth, maybe they feel different symptoms after getting a vaccination shot, whether it's headache, body soreness, aches, pains, fever, chills, so on and so forth. Right. Some of those symptoms, maybe some people don't experience any of those, or maybe just a couple of those. So, correct. Are there any home remedies or things that somebody could pick up at a pharmacy to maybe help alleviate symptoms in the short term, or would taking too much medication sort of combat what the vaccine is trying to do?
I mean, before you take anything, again, definitely check with your doctor, check with a pharmacist, make sure that it's something safe, make sure it's something that will help you and not do more harm in the long run. The biggest thing I want to stress that there are something called side effects, which are kind of expected from all vaccinations, and then there's adverse reactions. Side effects of vaccinations are typically similar. So with the vaccines, the COVID vaccines, whether it's Moderna or the Pfizer or the Johnson & Johnson, the common side effects are things like injection site reactions. So a little bit of pain, a little swelling, a little soreness in the arm. Typically, it's not too severe. It should resolve within a day or two on its own. I tell patients if it's cumbersome, if it starts to get a little annoying, you can certainly feel free to put a wet, damp cloth on it. You can ice it 20 on, 20 off. Most of the times you could medicate with Tylenol, as long as that's not something that's conflicting with any of your medications, which usually Tylenol is pretty safe. But again, you be sure to ask to make sure. And those things are typically not too severe. And they're expected. And I always urge folks to call me anytime they're experiencing any of these side effects, especially if they feel like they're worsening over a period of time or they're not getting better. Always call and check with a healthcare provider to make sure that's not something severe or serious. On the other hand, you have adverse reactions, which are things that are more serious, things like anaphylactic shock, more serious life-threatening allergic reactions, which have been they've gotten a lot of the attention lately in the media, and have scared a lot of people off. There's been a movement of people not receiving their second dose of vaccines, afraid of certain things, and definitely want to stress to people that these adverse reactions, they're extremely rare. If you don't mind, I pulled up a couple of stats that'd be relevant to it, just to make sure we get the numbers right. So we all know that the Johnson & Johnson, there was a little bit of scare with blood clots, and mid-April there was a pause on the administration of Johnson & Johnson. So these stats are straight from the CDC and VAERS, which is the Vaccination Adverse Effects Reporting System, which everybody needs to report, every healthcare provider who administers vaccines. So as of April 13th, there was 6.8 million doses of Johnson & Johnson administered at that point. Of them, there was only 6 cases of what was called that CVST, which is the cerebral venous sinus thrombosis, which is that blood clot. 6 people of the 4.8 million is an extremely low number. And when you actually dive a little further of those 6 people, you're looking at a very specific demographic. It was all females, women, age 18 to about 48. And they had an underlying history of what's called thrombocytopenia, which is like a low blood platelet count. So the pause really was not because we felt that the vaccine was not safe. It was to help healthcare providers catch up in terms of proper screening, finding out these patients, especially with this high demographic, had that risk, had an underlying low platelet count. And then also the most important thing was we found that treatment of this very specific and rare blood clot is very different than treatment of normal blood clots. Typically, we treat blood clots with certain medications like heparin, for example, anticoags, and if you treated them with the same exact regimen, it actually could be fatal to them. So that's what the pause was, to have healthcare providers catch up on proper screening and better treatment in case of the adverse reaction. But in general, it's a very safe vaccine. So I would urge everybody to definitely, whether you get the Moderna or the Johnson & Johnson, please get vaccinated and help everybody fight this battle, and that way we could move on with the next chapter of our lives.
I mean, I think you hit on it earlier as well, but I mean, are there any medications that would interfere with what the vaccine is doing, or would taking, if it's something like Tylenol, too much Tylenol sort of counteract anything, or would, if you have a really bad headache, would taking Tylenol 2 times a day or once a day, would that, I mean, certainly relieve maybe some of the head symptoms, right. But would that counter anything, or are there any medications that people should stay away from just while they're in the days after the vaccine?
It's very specific to patients. Certain patients, depending on their disease states or medication that they're on, they should stay away from NSAIDs, anti-inflammatories, aspirins, blood thinners. So the regimen should be tapered individually, and that's why I urge, when you're getting the vaccine, whoever the vaccinator is, just talk to them about it. They should be able to review your history and make sure they recommend the most appropriate regimen for you, whether it's Tylenol or something else over the counter that you can take to treat certain types of side effects, right? Whether you're talking about the body aches, mild grade fever, injection site reactions, soreness, things of that nature.
And again, to a big point you hit on, was certainly a trend for whatever reason with people not getting the second dose and just getting the first dose. I imagine it's just not 100% as effective, with you only getting part of the vaccine, but why is it so important to finish getting that vaccine? What do people need to know as to, I'll just, I got 1 dose of it, I should be okay? Absolutely.
So if you received a first dose of a 2-dose vaccine, which currently is either the Moderna or the Pfizer, you're not fully vaccinated. You're not fully vaccinated until 2 weeks after completion of the second dose, which is a shame because you got the first dose, and the chances are in your favor. If you've got the first dose and you did not have any severe side effects, adverse reactions, anaphylactic allergic reaction, then it's probably not going to happen with the second dose because it's the same shot given twice. Most people are in fear of not adverse reactions, side effects. Most of the times you see a lot of people who don't want to get the second dose is because they're worried about common side effects that are extremely treatable and not severe: mild grade fever, body aches, what they call flu-like reactions. So maybe getting sick for a couple days, but in the grand scheme of things, that's actually a very low percent. We've actually seen, for example, with the Moderna vaccine, less than 5% of the people who've actually received their second dose report those flu-like reactions. And within those 5% of people, a fraction, and I mean a fraction of a percent, are people who report any type of severe allergic reaction. Which I also would like to bring up something very important with the allergic reactions. The good thing about these vaccines is that they develop a fast onset allergic reaction. So worst case scenario, if you do have an allergic reaction to the vaccine, you would find out fast. And that's why when you're given the vaccine, you're told to stay around for about 15 minutes for monitoring, because we would find out fast and we would treat you on the spot. I believe of the 10 people who had anaphylactic reactions from the Moderna vaccine, 9 of them were developed symptoms within 10 to 15 minutes. So that's a good part about it. It's extremely rare to begin with, and again, it's something that we could find fast while you're still here. Take care of it. You don't have to worry about going home 5, 6, 7 hours later and start to develop an anaphylactic reaction. So.
Sharif, as we start to wrap up here, what else do people need to know either about getting the first dose of the vaccine, the second dose, or just getting vaccinated in general, especially people out there who, for their own reasons, are either hesitant to get the vaccine or don't want to get the vaccine, things that people should know and be aware about?
I believe, personally, I believe we all have a duty to protect each other and protect ourselves. So getting vaccinated, in my opinion, is helping your community, helping folks who are the most vulnerable in our community, our geriatrics, people who are extremely immunocompromised. The more we get vaccinated as a community, the more we protect each other, and we could help fight and hopefully eradicate at some point this COVID virus and be able to live life the way we used to live life, unmasked, large gatherings. And we're starting to see a positive trend, but we don't want to decline because of people thinking that they're vaccinated but only getting one dose of a 2-dose series and not really getting the job accomplished. So I urge everybody out there, please, if you're a candidate to get vaccinated and you haven't been vaccinated, get the vaccine, talk to a healthcare provider, talk to your doctor, talk to a pharmacist. And they're accessible more now than ever. Most local pharmacies have them. You probably can call, like with us. All you have to do is call us over the phone. We can make you an appointment and get you set up for a vaccine.
Sharif, I appreciate you taking out the time today and providing some insight into the vaccine and what people could do if they're experiencing any side effects or symptoms afterwards, and certainly stressing the importance of getting vaccinated in general.
Absolutely. Thanks so much. Again, we just touched a little bit on the surface of a larger conversation, but I urge people to ask questions. A pharmacist is a great resource. Doctors are tremendous, knowledgeable people, and sometimes they're very busy, and we can utilize pharmacists a lot more. They're very accessible. They're the most accessible healthcare professional. You could walk into your local pharmacy and ask them any question you want, and they're there to help you out. So I urge people to use pharmacists as a resource to them.
Of course. Sharif, thanks again for your time and for adding that in as well.
Thank you, Vin. I appreciate it. Thanks so much.
That is Sharif Elmenchawy, a pharmacist here at QRX Pharmacy on Mule Road in Toms River, talking about what happens with the vaccine, what you may or may not experience. And again, check with your doctor or your local pharmacist with any questions you have prior to the vaccine. And if you're experiencing any side effects after getting the first or the second dose of the vaccine. But the important thing to remember, go out, schedule your vaccine, get vaccinated, and do your part in ending this pandemic in New Jersey. We are heading in a good direction, but let's keep heading there and let's all protect each other. For Eyes on the Jersey Shore, I am Vin Ebenau.